It's also used to rehabilitate people with ligament problems of the knee. And as you see John performing it, you see the muscle works in a different fashion than it would do normally when you squatted. But you're still using the quads muscle to bring yourself back upright again. Do it slow, in a slow negative fashion, so taking a few seconds to come down creates more tension on the tendon, but also helps to rehabilitate the tendon. So you've seen all the exercises we use for treatment of this anterior knee problem. Sometimes when the kneecap is maltracking, usually to the outside, in fact nearly always to the outside, we try and encourage it to stay within its groove. So we'll apply a little bit of tape. There's a lot of extensive taping done by a lady called McConnell from Australia, but I'm just going to apply a simplified approach. Sometimes it can be a bit too extensive, and this is a nice simple approach that works quite well. So we push the kneecap over medially whilst the quad's relaxed. Apply the tape around the inside and then attach. And we cross over on the outside, pushing the kneecap over. So it's not fixing the kneecap too solidly, it's just emphasising the tracking centrally. Ultrasound is another modality of treatment we use for something like anterior knee pain. We can apply it to the tendon. It works really well at interfaces where the tendon meets the bone, stimulates the circulation and helps to prevent adhesion formation. This next treatment modality is using a laser beam. This stimulates the metabolic processes in the tendon up to 6 times faster than normal. Tendons have a poor blood supply and they have a slow metabolism, so this can help to speed things up. It's a very localised method of treatment, so the head is only about 2 millimetres in diameter, so you've got to be precise with your placement of the head, but it can really help for increasing the metabolism at the injury site. This next treatment modality is called pulsed shortwave diathermy. This technique has been going for many decades, but recently in the pulsed format you can get more energy into the tissues to help the healing, and there's a space in between each of the pulses to allow the body to dissipate the heat, and so it's more beneficial. When I used to work on the wards, we used to use this quite often for treating pressure sores, and it dramatically increased granulation tissue. So we use this as usually where there's inflammation, quite a lot of inflammation around a joint or a structure, and this is useful to speed the inflammatory processes up. It also speeds up lymphatic flow and reabsorption. This next treatment modality is called interferential, and this is where you've got 2 medium frequency currents crossing. As you can see, Charlotte set up 2 sets of electrodes there, the blue ones and the red ones, and where they cross in the middle, it sets up a beat frequency in the tissues which can be controlled by the machine. And the beat frequency can be anything from 25 Hz to 300 Hz. And this can improve lymphatic drainage, circulatory, blood flow, and also, as you can see, the contraction of the muscle tissue as well. So we can set it on different programs according to what we need for each patient. This next treatment method is where we're trying to stabilise the core and also improve what we call proprioception or balance reactions, really to teach the body how to balance and how to use all the muscles together in synergy to try and keep stable. So we're going to start off with a couple of core stabilising exercises for the midsection and the spine. This first one is a bridging technique, so we basically engage the muscles in the abdominal area, especially what we call the transabs. So we activate these by vacuuming in, which she's doing now, okay, and then pushing down through her feet, lifting the bottom up. Nice straight line, that's great. Keep nice and stable there, and then just try and lift your arms off now, Charlotte. Keep your body stable, okay. So nice straight line, no movement here. What the therapist can do then is introduce a little bit of movement with the ball to translate sideways, and she has to try and correct it back to the middle again. Okay. Pull back, pull back, pull back. That's good, that's great. Pull back, pull, 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 pull. And you start off with about a minute on this and then build up. Okay, and rest there. This next exercise is a bridging on the elbows, which is quite hard. And if you protract up now, keep a straight line, that's good, and try and balance on the flexible. So she'll feel abdominals contracting strongly and with the stabiliser. And to make it even harder, once she stabilises there, which is hard enough, is try and extend one hip and balance. That's it. It's even harder. It's quite advanced that, but if you can get stabilising on both legs, both elbows, that's good. This next exercise is an example of a stabilising movement we can do using a power plate. So we've got a vibration going through the body and Charlotte's having to maintain a balance. So say for instance for that anterior knee pain problem, if you wanted to re-establish the balance reactions, we're going to stand on one leg. So we'll stand on the effective leg, slightly bent knee, okay, and then we're going to get to take her hands off the handles and just grab the handles if she needs to, and then stay where you are, stay in that fixed knee position. And I just want you to rotate your upper body towards me. See if you can keep your balance like that, and then slowly back again and round. So we're changing a line of gravity slightly, and we're making the knee ligaments work a little bit harder. So that's without the vibration. So once she gets used to that, if we can add in the vibration, make it a bit harder. You ready? So you can set the timer for, that was on 30 seconds or 45 seconds or a minute. You can even up the vibration rate and intensity as well. So it's useful for what we call proprioceptive capability around the knee ligaments, that particular exercise.